You have 2 minutes on the clock and your time starts now. All right, that time is up, and we've got some answers through from the chat as well. But the answers that I would suggest for this kind of thing, and I'll always give more answers than are actually requested here, just so you're aware. This is also what you'll see in the exam as well. They're going to allow for a variety of things, and to get a sneak peek as well, you can see some of these answers are actually grouped together. So sometimes they will take one answer but not another answer if it's too similar, if that makes sense. That's called grouping. So here, 3 most likely differential diagnoses. These are our probability diagnoses then. We have impingement syndrome of the right shoulder. Again, we're specifying the side as well. And you'll note that actually gives you 2 marks as opposed to just saying impingement syndrome gives you 1 mark. Likewise, adhesive capsulitis of the right shoulder or versus adhesive capsulitis. There we go. Good tongue speak good. Now, I should point out actually there, impingement syndrome should be group 1 at the top there. That's a typo on my behalf. Rotator cuff tendinopathy of the right shoulder versus rotator cuff tendinopathy, or just tendinopathy would probably be less marks again. Glenohumeral, oh man, this is fantastic. Glenohumeral osteoarthritis of the right shoulder. This is why we use so many abbreviations. We get tongue-tied ourselves. Of the right shoulder, 1 mark versus just saying osteoarthritis, probably only half a mark there. So having a look through from the chat, we've got acute right subacromial bursitis, fantastic. Acute right supraspinatus tendinopathy, fantastic. Acute right C7 radiculopathy. Yes, actually, that would fit with this clinical picture. So I think you probably would get a mark there. It's not on this marking rubric, but again, if enough people do provide an answer, they can add it to the marking rubric there. I would probably be expecting a bit more kind of a shooting description or a little bit more of a nerve description, but it's not impossible. And so, yeah, I think they probably would give you marks there. And here we have a response from Nida as well. Capsulitis of the shoulder joint. Very good. Again, just try and specify the side. I know it sounds ridiculous, but you really need to spell everything out. Subacromial bursitis, yep, fantastic, and rotator cuff syndrome, fantastic, very good. So good answers. If you want extra marks, throw in the side. Easy marks to pick up. So look, guys, you're off to a good start. Very good to see such fantastic answers here. Well, of course, we've got another case up here. So let's get another 2 minutes on the clock, and next question starts now. All right, another question down. Let's have a look at some of the answers here. So again, the non-pharmacological management options, more marks for education on the natural course of adhesive capsulitis. So reassurance that with conservative management, often the outcome is good is a really important part of counselling for this condition. And that also applies if you do put, say, frozen shoulder or some of those other diagnoses from that last question. Likewise, if you just have it a little bit less specific, so education on the importance of mobility exercises, you're probably going to get less marks there. Active gentle stretching exercises targeting shoulder range of movement is going to get you the most marks, or just, again, simplifying that down, passive stretching exercises to improve mobility, less marks there. Now, tied into that would probably be things like referral to physiotherapy for stretching exercises. And I think that would be in that same kind of bracket, same category of marks, depending on how much detail you put in there. Now, for this as well, we're also looking at providing some symptom relief. So application of ice packs to the right shoulder for pain relief would also be worth something. Heat application to relax muscles around the shoulder, less marks in this kind of chronic time frame. There's a little bit less evidence for heat, but some patients still find some relief from it. And of course, recommend avoidance of exacerbating activities. If this is something that is exacerbated by regular activity, they probably need to do some modifications to avoid those recurring injuring activities that are potentially prolonging this condition. Now we have here from the chat, side sleeping pillow, and that would probably fall under that recommending avoidance of exacerbating activities, I'd say. So yes, you would get that mark there. Physiotherapy referral, yes. Again, if we want to really stretch this out, you can put regular physiotherapy referral for stretching exercises, and you probably wouldn't get an extra mark for avoiding regular aggravating activity. And part of that is that you need to diversify answers. So there's probably a little bit too much overlap between the side sleeping pillow and that. And I think that's an answer for the last question. I'm very sorry. And up here we have physiotherapy referral for improving range of motion and strengthening exercises. A good one, but I would just be very careful. You may have just gone into overcoding when specifying improving range of motion and strengthening. So if you're finding you're using that and or if kind of thing, if you're having joining words, you're probably giving too much detail and you would actually lose marks. I know it is crazy. An exam where you lose marks for showing that you know what you're talking about, don't get me started. But this is the trap that most people fall for. So catch yourself in those ones. Shockwave therapy. Yes, actually, there is evidence for that. And so it could be something worth trying. Platelet-rich plasma injections. The evidence for that is actually much less. And the college is actually cautiously steering people away from that at the moment. It's also so close to kind of, could it be considered a pharmacological management option? I would probably avoid that for this question. But in terms of management options, again, it is something that a lot of people could suggest, but I would probably stick to less kind of therapeutic injection kind of things, if that makes sense. It's a bit of a no man's land, and so if there is any doubt, I'd probably hunt for other potential answers there. But otherwise, fantastic responses, and good to see so many people jumping in the chat as well. Of course, we have more questions up here, so let's get another 2 minutes on the clock for question 3. Time starts now. All right, and we have some answers. So sometimes you'll come to these questions where they seem to have taken a step forward, but then want to actually go back. And so it might trip you up sometimes, might break up the flow, and sometimes it's because one question might lead into answers for the other, or vice versa. Sometimes it's just random and we have to deal with it. So in terms of what investigations are appropriate to confirm the diagnosis, the specific wording of this question doesn't specify initial or best. It's intentionally vague to give you a wide range of possible responses here. And so here we have things like plain x-ray of the right shoulder to exclude something, fracture or osteoarthritis. I think as long as you're specifying something sensible there, you would get the mark. Again, look at the detail there. It is just plain x-ray of the shoulder, of the right shoulder to exclude. So we're giving what we're doing, where we're doing it, and why we're doing it. If you were to just put shoulder x-ray, yes, you'd probably still get a mark, but you're missing marks there. So always try and be as concise but specific as possible. Likewise, ultrasound of the right shoulder to assess for rotator cuff tears. Again, something sensible in there will get you the marks. Magnetic resonance imaging, avoiding the MRI abbreviation of the right shoulder for detailed soft tissue assessment. And blood tests. So I think as long as you're listing something sensible with a rationale for it, you would get a mark. You would only probably get one blood test listed there. You wouldn't be able to get multiple. Coming in from the chat, we've got physiotherapy. Oh, I'm getting some of the old ones still through. Here we go. So from the chat, we have ultrasound of right shoulder. Excellent. So definitely yes. Again, try and go to that next level and specify why you're doing it. So what are you actually looking for? And ESR, fantastic. Again, I'd be specifying why you're looking for ESR, and again, avoiding the abbreviation. So spell out, as painful as it is, erythrocyte sedimentation rate. But yep, very sensible things. Now, the question did request 3. You've listed 2. If in doubt, take a wild guess. You won't lose marks for a wild guess unless you overcode. So feel free to always give something a random crack and see. You never know when you might catch an extra mark. All right, no other answers in the chat, so let's go to the next question. This case actually has 4 questions to it, so let's get 2 minutes on the clock and your time starts now. All right, so let's go to those answers. And again, you'll find these are all things we see in day-to-day general practice. They're not trying to throw too many curveballs at you. So what would you do if a patient's failing conservative management? You would step it up. So for this, you consider urgent referral to a physiotherapist for supervised rehabilitation. assuming you haven't done it already. And depending on what you had put for other answers, you may not get extra marks there. Non-urgent referral to orthopedic surgeon for surgical evaluation would certainly get you marks, again specifying time frame, who to, what for. And referral to a pain specialist for chronic pain management. Probably less marks in terms of overall how good is that response, but certainly an option. Now, from the chat here, we have radiology for ultrasound-guided cortisone injection. And yeah, truth be told, that is something that I think could be considered at this point, and I would dare say enough people would put that as an answer that it would probably be added to the marking rubric, and you would get the marks there. Again, really like that you've specified what you're doing and what for. I will catch you out on US guided. Spell out ultrasound. I know it's pedantic. I'm so sorry, but you just have to do that for this exam. Excellent. So that's case 1 down. See, they're not so scary. You guys got this.